All right, good morning, everyone, and thank you for joining today's webinar about making a successful transition to digital HEDIS. Today, we will get a chance to learn how to effectively deliver on the promise of better data, better measures, and better alignment, while also getting up to speed on the proposed digital HEDIS measures. Before we dive deep into it, there are a couple things that I would like to bring to your attention. If you have any questions during the presentation, please type them into the question box in your GoToWebinar control panel, and I'll bring them up towards the end of the presentation where the presenter will answer them for you. We'll also be sending you the presentation slides and webinar recording after this session is completed. Now, I will turn the time over to our presenter, Ralph Saint-Phard, who is a product manager here at Persivia.
Thank you, Rudy. Good morning, everyone. As Rudy mentioned, my name is Ralph Saint-Phard, and I'm a product manager here at Persivia, where I work with our clients to ensure that their patients receive the highest quality care available by using our population healthcare tools. Now, what are we going to talk about today? So today we're going to discuss how you can make a successful transition to digital HEDIS and talk about what's changing and the HEDIS landscape. What's changing? Everything started in 2015 when the NCQA introduced the Electronic Clinical Data Systems, a new HEDIS reporting standard which permits the use of structured data for HEDIS reporting by using data feeds coming from electronic health records, health information exchanges, clinical registries, case management systems, and administrative files. So basically, all the electronic systems available in the healthcare landscape. Electronic clinical data systems are a network of data that contains a plan member's personal health information and records of their experiences within the entire healthcare system. So basically, the ECDS measures will allow a health plan to capture as much of a patient's experience as possible across the entire healthcare system, not at just one single provider, not just at one PCP or one specialist. This reporting standard will basically provide the health plans a method to collect and report like structured electronic clinical data for HEDIS quality measurement and quality improvement. When NCQA introduced this architecture, I think the main idea was to show that HEDIS implementers can use healthcare information technology to increase efficiency and quality reporting. But at the same time, they also wanted to provide an incentive to connect to this data that's available out there and use it for quality reporting. Now, when we talk about the future of HEDIS and ECDS measures, but what's the difference between ECDS and traditional HEDIS, which we know is being used right now by health plans out there? So currently, traditional HEDIS uses administrative data, hybrid data, which includes medical record review and also patient surveys. ECDS, on the other hand, still uses administrative data, as we will see and down the line in the presentation, but it's mostly a streamlined process to close care gaps and also reduce the administrative burden that comes with medical record review. So we know that medical record review can be quite resource intensive, with health plans asking providers to provide medical records on their members that they saw. So ECDS is designed to reduce that burden by having direct access to these this data and the EHR without disrupting practice's workflow. We also know that all these acronyms can be a little confusing. So when we hear we already know about digital quality measures, DQMs, we know about ECQMs, and now we have ECDS. So what's the difference between all of these? So basically, digital quality measures are the format used to offer ECDS measures. So the ECDS measures currently available, provided by NCQA are DQMs. So basically expressed in a digital format using a standardized language, that vendors can use to just process the measures. ECQMs were originally developed years ago for CMS, EHR incentive programs, and they were designed for eligible providers or hospitals, and basically used to calculate measure performance. So DQMs use that same digital approach for their measures, and ECDS are in that digital format. So ECDS are just basically expressed in a digital format and available as DQMs. That's what the difference would be between these three acronyms. Now, when we finally transition to the ECDS architecture in the future, what will be the data collected by health plans to actually process these measures? So as I mentioned before, they will use administrative claims. They will also use data coming from electronic health records. So they will have a data feed into a practice's EHR and be able to extract patient information. They will use data from clinical registries, health information exchanges, state HIEs, regional HIEs. So that information will also be used in HEDIS reporting, and also data from immunization registries. So most of the data will come from these sources and available, aggregated by the health plan for HEDIS reporting. So I think it's also important to mention that currently there are 14 ECDS measures available in the latest HEDIS specification. And studying measure year 2023, so basically breast cancer screening and ADHD medication, follow-up care for children prescribed ADHD medication will be transitioned to only ECDS reporting. So the current administrative reporting will not be used. And starting measure year 2024, it will be the same for colorectal cancer screening. So this highlights the need to really understand what ECDS is about, and really starting to work on this transition. Now, how can Persivia help your organization with this transition? How can we help with ECDS? So first of all, we saw earlier that there will be a lot of data sources used for ECDS reporting, and Persivia is already getting data from all these sources. So we currently process data from clinical organization, we have claims data, we receive gap files from payers, and we have a natural language processing engine that is able to aggregate all of these records and tie them to a unique patient. So with that framework already in place, we are able to run these patients with all this data through our HEDIS program with our certified measures, and identify which gaps are open, and basically have a clear view of the patient's record throughout the entire care continuum. And based on these records, we can identify which gaps are open and which gaps are closed for a specific patient, and also display that patient, at the point of care for providers to review. And this is one of the requirements of ECDS. So all the information that is gathered by the health plan across the different sources must be accessible to the care team at the point of care. So using our population health tool, providers will be able to basically see their HEDIS performance and track each measure that they're reporting on in real time, and also be able to track, how cost and utilization trend by measure. So the workflow that we currently have, and that is evolving as we are getting more information on ECDS, is basically one of the sources that we use. We are able to process gap files, from sent to health care organizations, and that data is processed along with claims data, clinical data, to paint a clear picture of the patient's open care gaps. And once we have a comprehensive list of those patients with open care gaps, the user or the provider can export these patients to our care management tool, where care managers can follow up with these patients and work with them to close these care gaps. So this is the workflow that we currently follow. Now, ECDS is the way of the future, and we believe that Persivia is on track, and leading the way to a data-powered future. So ECDS will provide us better insights on a patient, because they will help us have a complete picture of the quality of the care that's being provided to them. And we already have the capabilities to aggregate structured and unstructured data and actually display these records, in one location. ECDS reporting will encourage real-time data collection, and will allow that data to be used real-time. And Persivia is currently working on that. ECDS will encourage data integrity, because basically it will lead to better efficiency and accuracy and integrity of data. And Persivia is also working on that. And basically, ECDS doesn't specify like a format, for data exchange, but they encourage the use of FHIR resources, which is an industry recognized language. And Persivia is already using FHIR, and are on our different platforms to process inbound and outbound data. So we are ready to work with you and walk into the future. Now, I mentioned earlier that one of the requirements for HEDIS reporting with ECDS in the future will be that the data will have to be available to the provider at the point of care. And Persivia is already on top of that, because with our integration services, we are able to process data from several data feeds, including data received from health plan, that will provide the full 360-degree view of the patient's record. So basically, we will aggregate data from all the different sources, run them to our integration services, and make the patient record available on our Persivia portal, or at the point of care and the EMR that you are currently using. And you can see here the user interface of what you will see at the point of care when taking care of a patient. So as I said before, the future is here, and we applaud the NCQA's effort to take HEDIS to the next level. And we believe that in the next few years, NCQA will, hopefully transition to full ECDS reporting. And we're here to help and provide you with all the assistance that you need to make that transition as smooth as possible, because it will improve the accuracy of data that is processed, and also reduce the burden on practices during and alleviate short audit requests. So we're ready.
Thank you, Ralph. We'll go ahead and take some time for questions now. The first question that I have here is, does the data used to provide complete information about the quality of health services provided to a health plan member have to be in a specific format?
Yeah, thank you, Rudy. No, so the data does not have to be in a specific format. So for electronic health records, so it only has to be a 2015 certified EHR. So we can also use data from health information exchanges, immunization registries, and care management systems. So NCQA has not specified a specific format as of now.
Okay. And then the second question that I have here is, when is NCQA planning to fully transition HEDIS to ECDS reporting?
So NCQA has not specified a date when HEDIS reporting will be fully transitioned to ECDS. So, and starting measure year 2023, breast cancer screening and ADHD measure ADD will become ECDS only measures. And in 2024, colorectal cancer screening will also transition fully to ECDS, which means that the hybrid methodology will not be used anymore. So these are the first three measures that will fully transition to ECDS, and I strongly believe that they will gradually transition all the other measures to ECDS over a number of years.
Awesome. So it looks like we've covered all of our questions as of right now. Thank you all for joining again. And as a reminder, we will be sending the presentation slides and the webinar recording in the next 24 hours via email. Thank you again, Ralph, and have a great rest of your day.
Thank you, everyone, for joining.